Hello, Miss Amanda. Today I'm going to be doing my competency reflection 8 video, just concerning or speaking about intervening with individuals, families, groups, organizations, and communities at our practicum. I'm covering the face right now. The image, but I'm at Southeastern Community Action Partnership, and yeah. And so now the first question is, describe how you critically choose and implement interventions to achieve practice goals and enhance client capacity at your practicum site. So to understand each client's particular needs and challenges, I myself need to collaborate with both the client or customer in this case and the caseworker. So just again, collaborating with them, having to work together with the client and the caseworker, setting attainable strengths-based objectives, putting suitable interventions into place, connecting the families with any resources that are available to them. So an example would just be with SNAP assistance, emergency housing, and or behavioral health services. I would then have to access the results and modify my strategy or the strategy that was created if needed and as needed, and then just eventually, or in that case, even I can't even talk, including or introducing motivational interviewing, as we learned in our social work 3 class. I guess depending on the client's level of, just based on what they want, implementing that would help. Just to engage with them and try to see where they're at based on their route, like speaking to them directly, asking them questions to see in what way you can help instead of assuming what is needed. That's a big issue sometimes. And then just, again, point out the strengths. And question number 2 is just describe how you apply knowledge of human behavior in the social environment, person environment, and other theoretical frameworks to employ client interventions. Again, just based on how the client, how your conversation goes and what they're asking, and just playing out on how to help them. Help is not the correct term. On how you can just help guide them in the correct path, again depending on what's needed. So the in-person environment perspective is what I would use to comprehend how various factors can impact clients' well-being and access to resources. For instance, when working with a single mother who's facing eviction, I took into account both the larger structural obstacles such as the region's lack of affordable housing, back again to speaking about rural communities, and her personal stressors. Again, engaging with the customer, the client, seeing where they're set, where their spot is at. Like what are these different circumstances that they're facing. From there, the next step is just fixing A in order to get to B instead of skipping B and going to C. I would also use ecological systems theory to pinpoint and fortify the client's support system. Through this method, clients are connected to long-term empowering solutions like job training or mental health counseling, in addition to immediate relief. Again, this is SCAP. SCAP can usually guide clients and customers to the right path, even helping them gain a job. They're not going to give them a job, but helping them kind of go towards that path. And so then number 3 is discuss your use of professional collaboration as appropriate to achieve beneficial practice outcomes. So for my work at SCAP, intrapersonal collaboration can be crucial. Case managers, housing coordinators, and medical professionals, and neighborhood nonprofits should be consulted to guarantee their clients receive their services. So again, going back to the staff training that I just took about a week or two ago, collaborating with the housing aid managers, just trying to see their perspective of how they dealt with the client, because it's one thing dealing with a client speaking about their job or childcare, and then housing might be a different type of topic, something more crucial, something more sensitive. Collaborating with them, trying to see where the client is set, or where they are at on their journey, and just assisting a family with children who are at risk of homelessness. Collaborating with a local pediatric clinic and housing department provides a comprehensive response to families' needs. Through these partnerships, service duplication was lessened, and clients were able to receive and get better assistance, basically. And then question number 4 is discussing how you're able to negotiate, meditate, and advocate on behalf of diverse client systems at my practicum site. So again, I'm working on the research guide, and that requires a lot of research, a lot of calling the different organizations and agencies that are around that certain county to see what is available for these customers. See what's open, see what isn't, because some of these resource guides are literally have not been updated since like 2014, and we're in 2025. So do the math, because I can't do it. But again, just having or using that research guide can help a client out. Again, if I can't help them, if the organization cannot help them directly, being able to offer that guide to a client can what's the word? Take them towards the correct path of whoever knows what or whatever. And even going back to working with clients one-on-one with elderly, I also help the clients there, writing and reading the program application, making sure that they knew what was being said and what was being offered to them, because in this case we were asking for some personal information like their utility bill, as well as how much they make a year, just to see if they were applicable for the program. I mean the applicable for the what is it? The application, just to see if they were able to receive the benefit of SCAP being able to pay for their utility bill based on how much they make a year. And now the final question is number 5, is describe how you facilitate effective transitions and terminations that advance mutually agreed upon goals at your practicum site. So again, I don't have as much more face-to-face client services or whatever experiences, but I was told, and I've been reading the cases, that we were moving on to a different part of the process, which is just the cases that are have been closed. So clients are prepared for the end of the services well in advance at SCAP. They read this paper and sign it, make sure they explain to them what is being said, to make sure they're on the same page. So again, they're prepared in advance. When transitions and terminations are handled with care and transparency. Also assessing how well they're done in reaching their objectives and giving them written recommendations and next steps to ensure continued access. Clients' accomplishments are emphasized to boost their self-efficiency as they become more independent. I heard them talking about possibly having some type of celebration in the middle of the process, because they just have a celebration at the end of the whole thing that they're doing, that the client is doing. So the end of the what? I can't think. At the end of the story, I guess, they have a ceremony. They even get like either a little award. I'm sorry. I'm not sure if it's a paper or if it's an actual award, but just because celebrating that accomplishment because it's not that easy to do certain things. Additionally, it was underlined that SCAPS programs would remain available in case clients need assistance in the future, ensuring that they felt connected with confident even after official services are ended. Official services ended. I don't know exactly how well or how many not examples, how many clients do come back for that. I'm not sure if that's just a gap that should be fixed or guided, but I do remember mentioning I did mention on my other presentation just how they should enforce some of these things, keeping up with the client, but that they know that SCAP is available to them always.